Welcome back, Med Warriors. Today we are going to explore the biliary system, a small set of structures with a massive step 1 footprint. Let's make sure you can crack any biliary question that comes your way. Let's start with the basics. Cholelithiasis or gallstones are very common, right? So risk factors, remember the 5 F's: female, fat, fertile, 40 and fair skinned. Patients usually have intermittent right upper quadrant pain after the fatty meals, and this pain is called biliary colic. Ultrasound is a diagnostic tool of choice. If a gallstone gets lodged and blocks the cystic duct, in this you call it as acute cholecystitis. Now the pain becomes constant and you will see the Murphy sign. You know the Murphy sign? This is very important for Usmle. So it is nothing but the pain upon deep inspiration. Again I repeat, pain upon deep inspiration during right upper quadrant palpation. So actually when you palpate the right upper quadrant, the patient may feel the pain upon deep inspiration. Ultrasound shows gallbladder wall thickening and pericholecystic fluid. If the stone moves into the common bile duct, we call it as cholelithiasis. Here the patients often develop jaundice and labs will show elevated bilirubin and alkaline phosphatase also. But it can get even worse. A blocked common bile duct. A blocked common bile duct, this can lead to ascending cholangitis, and this is potentially life-threatening condition. Clinically, you should look for Charcot's triad, which is nothing but right upper quadrant pain, fever and jaundice. If hypotension and altered mental status develop, you call it as renal splented, and that's a surgical emergency. Now let's move on to inflammatory bile duct diseases. First up is primary sclerosing cholangitis or PSC, and this usually affects young men and is strongly associated with ulcerative colitis. Imaging with MRCP or ERCP will show the famous beading pattern of the bile ducts, areas of narrowing and dilation. Patients with PSC have an increased risk of cholangiocarcinoma and colorectal cancer if they have IBD. Primary biliary cholangitis or PBC affects the middle-aged women. It is an autoimmune disease destroying small intrahepatic bile ducts. Labs will show positive antimitochondrial antibodies or elevated alkaline phosphatase. Symptoms include fatigue and pruritus due to bile salt buildup. Lastly, let's cover gallstone ileus. And this occurs, when a large gallstone erodes a gallbladder wall into the bowel. This creates a cholecystoenteric fistula. The stone gets stuck in the small intestine, causing obstruction in the terminal ileum because it's a very narrowest part. The classic findings here is pneumobilia, the air in the biliary tree, and signs of small bowel obstruction may be there. So remember, through the fistula, the stone passes into the intestine and air passes from intestine to the gallbladder. You can remember like that, which is called pneumobilia. And a quick note for pediatrics here, a condition called biliary atresia. And this presents in neonates with persistent jaundice and acolic stools. Early diagnosis and surgical intervention are crucial to prevent the liver failure. A quick recap. Cholelithiasis, intermittent pain after the meals. Fine. And next is acute cholecystitis for constant pain, and remember the Murphy sign. The next is cholelithiasis, jaundice and elevated ALP. The next is ascending cholangitis. Remember Charcot triad and possibly renal splented. PSC for beading ducts, young men with ulcerative colitis. PBC for AMA positive, middle-aged women. And gallstone ileus, small bowel obstruction with pneumobilia. And in newborns, biliary atresia means jaundice and pale stools. Amazing work. Biliary system is a favorite for step 1. because it crosses anatomy, pathology, surgery, and still so many points. But now you have got it locked down. Stay motivated. You are building not just for exam skills but clinical instincts that will serve you for life. I'm Dr. Ram here from MedMadness. See you next podcast.